Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I am your host, Shawn Needham, and I am streaming live from the Moses Lake Professional Pharmacy Studio. And we have the pleasure of having Chris Habig back on our show again. Super excited. He is a wealth of knowledge in free market medicine. And one of the things that we talk about, especially lately, there's been a lot of individuals that have really wanted to move jobs, partly because they've been forced to do things they don't want to do. And I think in some ways that's okay because some people are thinking about being entrepreneurs and opening their own business, doing something different. And I will tell you, one thing that really scares a lot of people is the health insurance question. Well, I got to keep this job because I need my health insurance. Well, let me just tell you this. Employers have used health insurance to create slaves of employees. Guess what? You don't need that health insurance that employer pays for, and you pay a lot for it too. Let's not forget that. There are other options that are very affordable and let you be accountable and responsible for your own health care, and you get to drive it instead of an insurance company or an employer telling you where to go, what's covered and what's not covered. So Chris is going to go over that today. You don't want to miss out on this. This is a perfect opportunity. If you're ever thinking about making some changes, this is a perfect opportunity to listen how you can get affordable health care without a big employer sponsored plan. Chris, so while we're on the subject, go ahead and just get started.
Hey, Shawn, pleasure to be with you again. I notice, if you notice, I wore my insurance does not equal healthcare
That's
t-shirt
right.
just for this
Yep.
episode. So we we like that slogan so much, we decided to slap it onto our company t-shirts and give it out to everybody. This is one of the biggest subjects that we find when it comes to just innovation across the marketplace. Industries, people are really held back, and we do a lot of work with like co-working spaces, entrepreneur organizations, incubators, who give people with really great ideas who've been kind of in corporate America or they're out on their own, give them a safe space to really blossom with their ideas. And every single one of them, the people that run these incubators or co-working spaces, what we call them, what you want, they go, Chris, healthcare is the number one question and the biggest thing that holds people back from stepping out and starting their own companies. You might have something that, say you built a better, engine, or you have an electric car and you're have these ideas, but you're so afraid to leave your job because of this whole notion of, I have to have this
Right.
really catastrophic health plan. What if? And most of healthcare is just built on this question of what if, when in reality, a very small percentage of people are going to even experience those what if scenarios, and the emergent care, that type of stuff, that we think we need to have health insurance, health coverage, really, for those incidents. So it's a huge barrier.
Right. It is. And I write about it in my book, Sickened, how the government ruined healthcare and how to fix it. And I think one of the things is that employees need to start being the driver of healthcare. They need to tell their employer what they want and what they don't want. And if they are educated about it, they can realize that, a plan that is costing their employer and them, $1,000 a month, they could take that money and put it in their pocket and do a lot better things with it.
It's a negotiation. Every
Right.
employment contract is a negotiation, and
Absolutely.
you don't see people thinking about that from an employer standpoint. It's, hey, here's the offer, take it or leave it. That's never true. If they
Nope.
want you badly, especially in today's labor market, you have some wiggle room on that one. So what if you said, hey, I'm going to go find an insurance plan, or really a coverage plan. Again, I got to stop saying the I word, in this,
Yeah, right.
terminology here. I'm going to go find a coverage plan that actually suits my needs and where I am in my life right now. Usually, that can be short-term insurance, that can be health shares, that can be health reimbursement accounts. You can get very creative with it. You just don't need to go and buy, whatever's presented to you. But that's a negotiation. Is my point is, what if you went to your employer and said, hey, how about this base salary? Plus you kick in what you'd be spending on my insurance policy. You give me that money to go spend it the best way that I think, is possible for my family. What's wrong with saying that to an employer? Just people don't do it. They think it's a take it or leave it, and this is the option, and I'm beholden to it.
Right. And I think, the bigger the employer, I think the more difficult that's going to be. But if enough employees step up and say, hey, this is what I want, I think it would, free, not only in the end, liberate the employee to decide what's best for their health needs, but
Mhm.
also the employer, because, employer sponsored health insurance is so expensive.
It is expensive, and even with the biggest companies out there, they have the option of opting into a plan. We went through this with my wife and joining a school here locally here in Indianapolis, and they presented her this benefits package. And I kind of an aside, I get upset when people call it, oh, these are my benefits, and it's only health insurance. And I'm like, well, let's redefine benefits in the first
Right.
place. There's all kinds of definitions out there about it. And it would have been more expensive for her to join that employer plan compared to the health share plan that we have in place right now. It would have been more expensive on a monthly premium level, and it would have been more expensive if, God forbid, something actually happened and we needed that financial backstop to any type of major health issue. And so we kind of laughed at that, like, this is nuts. This is
Right.
absolutely insane. And so
And,
we're like, well, no, thank you. We're going to opt out of it.
yeah, and that a lot of people just don't realize that. They think their insurance is just such a good deal that they think they're getting a good deal. And I love it when people say, "Well, I've got great insurance." It's like, you know what? I just remind people there is no such thing as good health insurance in the traditional market anymore. There's just not. It's super expensive. Nothing is covered. If it is, it's high deductibles. It's a lot of out of pocket stuff. You'd be better off paying cash for a lot of things.
Oh yeah, when you pay cash for medical care, the price is significantly lower, and you see that up and down medical care. Um, I'm not sitting here saying, hey, insurance is never needed. There are some very
Yeah.
small percentage of cases where it absolutely is needed, and that's what it is. It's a financial tool. But we don't go around saying, hey, Shawn, I have the best homeowners insurance policy that you've ever seen.
Right, right.
And it's like, oh, my auto insurance is great. I got an awesome life insurance. Nobody wants to use insurance plans, yet people brag about going out and using a health insurance plan. It is the most screwed up dichotomy like I've ever seen in my entire life.
Yeah. Now, and here's one of the things I want to back up just a little bit on. You kind of alluded to a little bit about the percentage of people that a small percentage of people that do need that health insurance. Now, here's one thing I want to drive home is that the best health insurance we have is not some policy or plan that we can buy. It's how we take care of our bodies. And 85 to 90%, I'm guessing at those numbers, but I mean, I've been in healthcare long enough. I just see it around me. Most all the things that are routinely seen in doctor visits, hospital visits are lifestyle related disease that can be changed or can be eliminated if people change their lifestyles. ERs aren't, ERs even are not full of, car wrecks and heart attacks. I mean, they're full of people that have GI problems. They're full of people that have out of control diabetes. They're for people that have, lung problems because they were smoking. So in reality, that $40,000 broken leg or that car wreck, that's a small percentage of what we call healthcare when really what we're really dealing with in our system is a sick care system.
Absolutely, and I think you're right on that. It's like less than 2% chance of the average American actually needing to use a ER or have that emergent care. The bigger issue, like I agree with you. It's more lifestyle. And let me put another one in there, a little more food for thought. I was talking to a guest on my podcast about this, and he mentioned something about how many people miss medical appointments, whether it is a standard primary care appointment,
Mhm.
chemotherapy, whatever it is. There's like 5 million Americans each year that miss a medical appointment. And there's a whole host of issues, whether it's access, time, transportation is a big issue. But he said we're able to look at the data and find that every missed medical appointment is a 2% increase in chances of basically morbidity. And I'm like, wow, that is really, really
Yeah.
profound. So one of the biggest issues beyond, people seeking primary care at ERs is people foregoing medical care. And that's one of the biggest problems I think that we just don't talk about. And there's a whole host of issues for that, right? There's always a layer upon layer upon layer of people's rationale and reasoning. But lifestyle combined with irregular checkups, there's a very slim chance that you are one of those poor souls that gets struck by lightning or has a tree fall on them or gets in a car accident, something
Right.
along those lines, right? Things that you
Yeah.
can just do absolutely nothing about. And my heart goes out to them, but that is no reason to live in fear and this whole what if aspect that modern day health insurance is built around.
Right. And I do think this too. I think part of the problem is, Chris, is that it's not, we can't just blame the consumer, which is the patient. We can't just blame them. We can blame the system because, I mean, let's face it, because of the way that traditional insurance, and this is whether it's Medicare, Medicaid, or a traditional, Blue Cross United plan, they don't reimburse doctors for preventing problems. They don't reimburse
Mhm.
for, they don't reimburse enough so the doctor can spend plenty of time with the patient. So in some ways, I'm not surprised that a lot of patients don't show up because they probably feel that the visit was useless, because most doctors just don't spend enough time with them. Now, there is an alternative to that, and I'm hoping you're going to go into that.
Everybody has a choice. We,
Right.
we talked about this a bunch last time, and it's like
Right.
everybody has a choice. I'm not big on pointing fingers and saying, "Hey, this is your fault." Whatever accidents do happen, or there are circumstances that are outside of people's control. What I do point fingers and blame is if you make a mistake and you keep making that mistake without learning from it. Now you're absolutely at fault. You're an accomplice here. That extends to patients who might hear this podcast and hear other material and things that you put out that say, hey, there's a different way to do this. And if they keep going back to it with knowledge that they have a choice for better access, lower cost, really better quality medical care, and they keep going back to, kind of quote unquote, this system, I'm going to blame them. I'm going to blame
Yeah.
physicians who say you have a choice in how you take care of patients and how you educate patients. I'm going to blame you too because you have a choice in everything you do in life and in your profession. Um, so are they accomplices? Sometimes I'm sure there's people out there that say, hmm, "I like this. I'm making a lot of money from it from an administration standpoint," or you're a patient and you just are so frustrated and you're kind of a loss of the lamb out there. You don't know how to use your brain to go out and seek medical care that you don't need to have these massive insurance plans for. One story I always like to tell people is that I am insanely jealous on behalf of all of our clients here at Freedom Healthworks that you know it's been ingrained and pounded into our brains since birth that we have to go see a dentist twice a year.
Yeah. Right.
It is the greatest medical marketing I have ever seen in my entire life. And I actually traced that back and asked my dentist and a couple other ones about it and read about it. And we only do that because there was a toothpaste company back in the 1920s that wanted people to buy their product and get brushing their teeth on a regular basis. And it said, oh, by the way, go see your dentist every 6 months for checkups and make sure that your oral health is top notch there. And I'm sitting here thinking, well, where's the AMA doing that for
Yeah.
physicians, right? Where are these companies out there saying not just every year you should go see your doctor? Because I don't think that's enough by any means. But going back to what I said about making sure you're keeping regular medical appointments, I mean, you should be engaging your doctor almost every couple of weeks, whether it's for the kids, whether it's for yourself, whether you have a question about an exercise regimen, a nutrition regimen, stress, mental issues, emotional issues. Talk to your doctor about this because they're going to be able to help you out. And it's this whole thing about like you mentioned. I don't know how much it's going to cost. And if you know how much it's going to cost, Go figure it out. It's really not that difficult.
I was thinking maybe the reason patients listen more to the dentist is because they see more value in the dentist because they see the they see the results of they don't want yellow teeth, they don't want crooked teeth, and they see the value of going to the dentist. Whereas when they go to a traditional doctor, they don't necessarily see the value because the doctor doesn't spend enough time with them to educate them, and they feel like, oh well, I've got another problem. The doctor just prescribes them the medication and then leaves, instead of actually saying, hey, well, this problem that you're having with your stomach, you don't need a medication. You need to change your diet. But most doctors are either ignorant of that or they just don't take the time. So, can you comment on that?
Yeah, it's interesting. So it's more of the tangible benefit of going out there, sitting in the dentist chair, getting your teeth scraped, getting some fluoride, getting polished, and getting your bag of toothpaste and your toothbrush, and out the door you go. And there's a great book out there called The Power of Habit, and so it talks about dental care and specifically in the fact that we have associated the mint taste as accomplishing something. We're taking care of our teeth because we have this clean,
Right.
minty feel about it. And again, that's how it was marketed for toothbrushes and back in the 1910s and 1920s. Is they said, hey, if you are done with a meal, you have this film and this grit on your teeth. You need to get rid of that grit. They had no idea what it was, but they said, get rid of that grit. Brush your teeth with this toothbrush and this toothpaste, and then you have that clean feeling. I think you're exactly right that when you go to the doctor, I mean, what do? They put your hands on you, they'll examine stuff and say, hey, you're doing a great job. Good job. Keep it up. Or they'll take some blood out of you, and a couple of days later, you get your results. And if people are like, oh, man, no problems, I guess I don't really need to go see the doctor in a couple of months. So I don't know how to fix that part of it. How do we reward ourselves for going and staying in good shape and going to see the doctor and getting the labs and getting the tests we need? That might be something that is for a lot smarter people than me. You reward people, not just with a sticker or with a pencil walking out the door. But that's really what we're up against, to get people to change their habits and change their attitude about seeking medical care, not just when they need it, like something is wrong. Like, don't wait until you're bleeding out your eyeballs to go call a doctor. Call them beforehand and say, I want to make sure that my engine is running at peak performance here. What's the best way to go about doing that? And chances are the doctor's going to be like, yeah, I need to see you every couple of months just to make sure we're all good, or at least let's have a phone conversation or a text conversation. Because there's a lot of different elements about people's health that play into our overall well-being. I mentioned mental health, stress, workplace stress, family stress, financial stress. That's a lot of stuff that is not going to manifest itself in a blood test, or a stethoscope, on your chest. So it's this whole concept of environmental health, and then being able to look at your doctor as more of a partner and not somebody who's a last resort when you need them.
Yeah, right. I think in some ways you answered the question yourself. How are we going to do that? Well, I think how you do that is, if doctors create value in a patient's life and show them how good their engine can run, I think the patient will keep doing it. It's no different than, when a patient or a person hires a personal trainer at a gym. If they get good results, they're going to keep doing it. Why wouldn't they, right?
Look at how many people start an exercise program and give up on it before any type of health benefit is seen.
Yeah, exactly. Right. So if they had a physician leading that charge and they could see all the other benefits and they're educated on all the other benefits while it's happening, I think we'd have a lot better results. But there again, in the traditional system, that's just not how it works because patients haven't seen that. Now, let's go ahead and talk about alternatives because there are doctors that do that. Is that correct, Chris?
Oh, absolutely. There's
Okay.
doctors that will do all kinds of stuff to make sure their patients are as healthy as they possibly can be. Yeah.
So are those doctors in the usually are those doctors in the traditional healthcare system? I mean, do they usually take regular insurance? Because that's a common question I get when a patient wants me to refer them to a doctor that does these special services like this. The first question they ask is, do they take my insurance? What's your answer to that?
My answer is that they will see everybody regardless of your health insurance. Direct care is the only health model out there that will see every single person out there and not discriminate against health insurance policies.
That's right. Let's for those of us those that are on the call that might be new today, Chris, let's explain what direct care is. Let's explain this new phenomenon, even though it's not new, so people know how to access a doctor that can really, really help them with their health and not just treat sick care.
Direct care, it's been around for a while. It's had some different iterations called concierge, direct primary care, direct specialty care, self-pay, membership medicine. There really hasn't been a concentration or really coalesced around any single term. But it is when your trusted physician works only for the patient, only for you. There's a big, one of the conversations I enjoy having usually around health insurance again is, when you're talking to a broker from a business standpoint, who is actually the client in this one? And so a typical client relationship is whoever pays you.
Right.
I'm going to write the check to my doctor, in this case, in direct care case. And there is no other revenue stream for that doctor. So that doctor is now incentivized to keep me as healthy as he possibly can, or else the cost of me switching and going to somebody else who fits my care needs or my care style is very, very low. You compare that and contrast it to what an insurance-based physician is up against, and that physician, is getting paid by insurance companies. They call it reimbursement. So if you're a patient and you say, I have a great insurance plan, I'm going to go see this physician that I picked from a list, and I'm going to call around and get in the office that can see me as soon as possible, which is usually anywhere from a week to 3 weeks away. I'm going to go in there and I'm going to throw this insurance card down and say, hey, basically, what does this get me? And then the doctor is going to have a quick little visit for you. And then that doctor is going to submit that claims data with a bunch of different codes to an insurance company. And so when the patient isn't directly paying their medical bills and paying them to their trusted medical professional, you really distort that entire client-patient relationship. And so that's a long answer to a very short question there, but that's what direct care is we favor a membership model that is all you can access primary care, all you can eat primary care, kind of buffet style healthcare. And you get to see the same doctor because you join that physician's practice, and they get to know you. And so they know your environment, they know your family, they know your history, they know your medication history. And so the likelihood of medical errors decreases significantly because they know what kind of medications you're taking, they know what your lifestyle is, and they're able to help you achieve your medical goals. Because you can text them. The access just shoots up. It skyrockets compared to what traditional medical practices can do. And so that's when I say direct care will see every single person under the sun. It is open to everybody. It doesn't matter if you are uninsured, if you have commercial insurance, employer insurance, Medicare, Medicaid, it does not matter. In my point of view, insurance plans really discriminate against some of the best options for people, and they have these narrow networks that might not fit somebody. And so when we say we open it up, we will see every single person out there. It's the great equalizer in healthcare. And we can have somebody on Medicaid sitting next to a CEO of a Fortune 500 company in different exam rooms, and they're going to get amazing healthcare from their physician, and they're going to pay a very low cost to be able to access that. And that's the beauty of the model.
When the consumer pays the bill, service goes up, quality goes up, and price goes down. But it sounds like you just said that it's affordable, but it sounds like something like this must be super expensive. Can you give us an idea of what it would cost somebody to have direct access like this to a doctor?
Depending where you are, and this is another great thing about the model, is that it's relocalizing healthcare. It's making local pharmacists and local physicians. It's making those people the quarterbacks of your care team, which is beautiful. We've talked to physicians in, there's a great physician down in Appalachia in Eastern Kentucky. He charges his patients $20 a month because that is what the cost of living standards are down there. And that's what people can afford. We also work with physicians in Hawaii and on the East Coast in major metro areas who are potentially charging $150 to $200 a month because that's the cost of living in those areas.
Right.
It's no longer one size fits all.
And it shouldn't be.
It shouldn't be. It shouldn't be coming out of Washington, D.C. saying this insurance code or this medical code or billing code reimburses this, whether you are in the middle of the country in a rural area with a very low cost of living, or you're in the middle of New York with a very high cost of living. A one-size-fits-all approach does not work, and we've seen that time and time again from regulators across industries, and obviously healthcare is at the forefront.
Right. And I always, when the free market is at work, that's when the consumer and the doctor is going to benefit the most. I mean, the patient and the doctor, both of them are going to benefit. And one of the ways the doctor benefits is, like you said earlier, is that, first of all, the doctor has a choice whether they want to stay in the traditional healthcare system or not, and under the insurance model. But one of the benefits that I always see is I see, I've met many direct primary care doctors all over the nation, and I have never, ever met one that is not happy in their practice. You've met a lot more than I have. Chris, can you comment on that?
I usually tell people that about 60 to 70% of the clients that work with Freedom Healthworks, if they did not get out of the fee-for-service and insurance-based practice, they would no longer be physicians.
Yep.
They would quit and leave medicine altogether.
It's that bad.
And it's that bad. And this isn't, I'm not just talking about 65, 70-year-old doctors who are kind of at the tail end. I'm talking about doctors in their 30s.
I know. I've seen it.
And that's terrifying. And one of the reasons why we started this company, to go out there and help those people take control of their profession, take control of their life. And it's very rewarding to talk to them and say, wow, I can't go back. I would never want to. And my patients don't want to. And so when we look kind of on our strategic planning, we very much want to move into specialties, because if a patient, understands the value of having a physician who works for them and is accessible when they need them, we don't want to say, oh, okay, you need to go see a specialist because the primary care can't handle this right now. I'm going to send you back into the hospital system. We don't want that to happen.
No.
And so we're trying to build out a completely alternate healthcare system, utilizing those direct care principles across specialties, into surgeries, into, eventually emerging care, that people can choose high quality options for affordable prices and transparent prices.
Yeah, it's definitely happening. I think, initially the primary care doctors, they had to build out the network first of all. And then once there was enough primary care doctors that are, need referrals to the specialist, that's kind of how the specialty field in direct care is starting to grow.
Oh, absolutely. Absolutely. And really, to go back to what we were talking about before, from a small business and from an entrepreneurship and an innovation standpoint, that's one of the questions we get is, okay, so I understand that I want to go out and start my new company and grow this and become the next Amazon and become the next Tesla, whatever it is. This is my dream. But, my insurance plan is holding me back to my previous employer. Burning candles at both ends. This is not sustainable. And they say, right, I understand the primary care aspect of it, but what happens if I really get sick? How does this work? And then that's where we talk about the alternatives to insurance and health insurance, kind of non-insurance, or how to pick the best plan based on your situation and your family needs. And to see the proliferation of a lot of non-insurance products start to happen. I mentioned health shares. There's a bunch of other ones out there too. Couple that with accessible, trusted primary care, you're going to be in the driver's seat of your healthcare for a very, very long time using those combinations.
Yeah, and that's the only way we're going to fix this problem. It can't be from the top up. It's got to be from the bottom down. And really, it starts with the patient. And as healthcare professionals, we need to educate and empower patients to take charge of their own health. And that includes financially. So what they decide to do with, a health insurance or a health savings account or how they pay for their healthcare. That's very, very important, because when consumers start driving that, that's when the system starts changing.
Exactly. And I actually had this conversation with our Indiana Senator, Mike Braun. I was talking to him, and he's like, Chris, what you're doing amazing things. Your Freedom Healthworks is doing incredible things, as well as the industry is in grassroots, getting involved grassroots to really show states, legislators, federal government how things can be better. He goes, what do you need? How can we help? And I said, Senator Braun, I need legislation, passed that actually opens up the market and decouples health insurance from employment. And he started laughing. And he goes, Chris, the only way that that's going to happen is if you guys show us that it's possible. We're not going to get anything done in Washington. And I just wanted to share that to just really drive home the point you just made. It has to be us doing it, not just me, Freedom Healthworks, but you and what you're doing. The rest of the people in the industry, patients, businesses, all working together to show really, our quote unquote benevolent leaders in Washington and in state capitol, this is what we want. This is the direction we want to move. We want more choices. We want more freedom. We don't want more of the status quo and what has gotten us in trouble in the first place.
Right. And consumers can drive that again. Like you said, an employment contract is negotiable. No different than their wages are negotiable. So is the healthcare portion of it. So employees, listen up. If you work for somebody, you can negotiate that. Don't think that you can't. And if you can't, then, and it doesn't fit you, then go somewhere else or do your own thing. Be an entrepreneur. Be liberated, and you can choose your own thing. And don't be scared of not having this traditional health insurance. If you're scared of that, you'll never ever change and get you out of that. And I think employers have used health insurance to create, slaves of employees, when they really don't. I've heard many employees say that they don't like where they work, but they got to have it for the health insurance, and that just needs to change. People need to be liberated from that.
I mean, exactly. It's a construct that's left over from World War II, the history of it, but it centers on government involvement in labor markets.
Right.
And it's just grown from there. It was never supposed to be a long-term fix. And yet here we are 80 years later with this massive albatross weighing down innovation and really increases in standard of living as insurance premiums skyrocket up to $22,000 for a family of four.
Crazy.
Last year.
Yeah.
And it's the numbers are just crazy, and it's hurting a lot of good people out there who just aren't aware that it doesn't have to be like this.
Well, and it's just perfect timing for this podcast, because there's a lot of people that are wanting to make changes right now in their employment, and they just don't feel free to move because they're scared because they will lose health insurance. And my personal opinion is, Chris, I mean, it's just numbers, pure numbers. I don't think it's sustainable what we're doing. We can't have the inflationary costs of healthcare and health insurance premiums going up like it is. It's not sustainable.
Absolutely. But at what point does it break, Shawn? And that's a big question. When are employers going to be fed up with 12%, 13% increases year over year to say, screw it, there's a better way to do it, or I'm going to go research alternatives? I thought we'd see that breaking point 5 years ago, and we didn't. And people just continue to absorb increases in cost and lower quality care, higher prices. It's moving in the wrong direction completely for vast majority of people out there. And, that's one thing. I cannot look in the crystal ball and say, when are CEOs and CFOs and presidents of companies going to say, this is ridiculous? Are they going to be the ones to do it and say, look, we want to take better care of our people? Or are employees going to say, hey, C-suite, hey, Mr. Business Leaders, I don't want to do this anymore. These health plans are not helping my family out at all.
Right.
In fact, it's moving us in the wrong direction. And so that's one thing I try to keep an eye on, and really the pulse of the industry here is to say, who's going to be that first person out there from a macro sense to say, let's go research different things. It's happening. you know, you hear stories and you talk to people and companies that are isolated, but typical industry, typical companies are just not doing that right now. They just kind of tuck their heads in between their knees and just kind of absorb these increases every single year. And if that's not the definition of insanity, I'm not really sure what is.
Right. But we all have a choice, right?
We have a choice.
That's right.
That's the
I
beautiful
love it.
thing about it.
Yep.
That's the beautiful thing about being an American is you have a choice what you do every single day.
Yep.
You might not like the choices, or you might have the choices that you want to strive to, but that's your ability to be able to go out there and get the best options for your situation.
So how does Freedom Healthworks help with choices?
We like to say that we give patients, doctors, and employers an alternate choice to the status quo when it comes to healthcare. So what do I mean by that? Well, hey, doctor, call us up. We're going to help you get started in your direct care practice, taking cash, taking memberships. It's a beautiful thing with your recurring revenue. And then from a patient standpoint, we're going to give you options, across the United States. We're in about 24 states right now, in different metro areas. So come join one of our practices, and you're going to experience an entirely different way to have medical care. Again, health insurance does not equal medical care. And so I just want to reiterate that all the time. And so when a patient joins on their own free will and volition, and they understand the concept of this, and what we usually see is patients who have experienced healthcare before, and we're like, this sucks. I don't want to go through this again, whether it was them or a loved one, and realize that hospitals are not good places to be at all.
Right.
You want to stay away from those places. And so what we do is say, hey, look, come try us out. If we're a fit, that's great. If not, well, we're going to help you find the best fit possible for you while trying to keep you away from that insurance-based system, because we don't want you to go back in there. And then from employers, kind of what we talked about, I love working with companies that are in that 15 to 20 or less employee range, because those are the mom and pop organizations who truly care and get to know their employees. If they have somebody who's sick, like a server or an employee for them, they understand that and they feel that and they want to pitch in and try to take care of that person. You get lost a little bit in bigger companies, but even with 200, 300, 400, 500 people, that is a significant impact to your bottom line. And I would encourage, people in the C-suites out there to really poll and do some focus groups to say, are these health benefits actually working for you? And then we can work with you to put in pilot programs. So you don't need to do a wholesale change. Next year, let's offer a Freedom Doc plan in conjunction with your current insurance plan, and let people choose. Do they want this new cash-based subscription option over here, or do they want the status quo that's going to cost them tens of thousands of dollars?
Right.
Let the people choose. Just give them the choice.
Right. That's awesome, Chris. Thanks for educating us on that. So, if you had to, in 2 sentences, sum up what an entrepreneur should do with healthcare today, what would that be?
Ooh, 2 sentences. All right.
Right. We just did it in a half hour.
Yeah, I know. Outside of educating, I'm trying to wrap it up for you. I would say if they are truly wanting to go out and let go and untether themselves from that sea anchor of an employment position, the number one word that comes to mind is research. If you're not going out there and looking at alternative models of healthcare, you can do yourself a disservice.
Yep.
Talk to the brokers. Figure out where their paycheck comes from. First of all, who's paying you? And it's okay to ask those questions.
Yeah.
Who's paying you and where is the money? So if you want a sentence or two, I would say track the money and do your research.
Awesome. So, Chris, how do people get a hold of Freedom Healthworks?
You can find us online. You can give us a call. So freedomhealthworks.com. We are on pretty much every single social media platform out there. We're on YouTube. Freedomhealthworks.com is a host of information for physicians and medical professionals looking to make a change. From an employer and a individual standpoint, check us out on freedomdoc.care. And that website is going to have a lot more information geared towards individuals and what this type of model really means for them and how to use it and why it could be a good fit for them.
Awesome, Chris. I so appreciate you being on our show. You definitely have realized our goal at Health Solutions, which is to educate and empower consumers to take charge of their own health. And that's exactly what we have talked about over the last 40 minutes. So thank you so much, Chris. It's always a pleasure to have you on. And as always, thank you for tuning in, listeners and viewers. Thank you so much.